Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Xzabia Caliste. She's a vascular surgeon. Today's Kevin MD article is The Silent Disease Causing 400 Amputations Daily. Xzabia, welcome to the show.
Thank you so much for having me, Kevin. This is a wonderful opportunity, and I'm grateful.
All right, so we'll jump into your article in a bit, but just briefly share your story and journey.
So, I'm a vascular surgeon out in Albany, New York. I completed my training in 2016, so I've been practicing for about 9 years. I'm an associate professor of surgery currently, and I treat all aspects of vascular disease. I treat carotid artery disease, aneurysmal disease, peripheral arterial disease, and venous disease, to name a few. And in that capacity, I treat things in both an endovascular or less invasive way with things like stents, as well as open surgical interventions like leg bypasses or open
Mhm.
abdominal aortic aneurysmal surgery as well. I'm an active member of the Society for Vascular Surgery, and in that role, I've currently been elected to be an ambassador for the Highway to Health program, which allows me to highlight vascular disease and the work that vascular surgeons do so that we can increase awareness and help to affect outcomes for our patients.
All right, so your Kevin MD article is The Silent Disease Causing 400 Amputations Daily. For those who didn't get a chance to read your article, just tell us what it's about.
Yeah, so it's a really impactful article because it really does highlight things that I've been able to see professionally as well as a little bit of my own personal experience. And it's really about the 400 amputations that occur on a daily basis in the United States of America. As a kid, I grew up in the Bronx in a Caribbean family, and as an immigrant family, we're all very big on social gatherings.
Hmm.
So I had the opportunity to spend a lot of time with my multiple family members, including my aunts and uncles, and two of which suffered from peripheral vascular disease, undiagnosed at the time. They had high blood pressure, they had diabetes, and I saw them go through having one toe amputated,
Hmm.
several toes amputated, all toes amputated, and one ultimately had a below the knee amputation, and the other ultimately had an above the knee amputation. And over time, I saw them, being ambulatory active people to people who are using canes, walkers, and ultimately wheelchairs. And that's where they remained until they each passed away. So, getting to see the devastating effects of high blood pressure, diabetes, and I know that they never saw a vascular surgeon, their circulation was never assessed. And that was extremely impactful for me. And, fast forward years later, and I'm a vascular surgeon. And the reality is that the personal impact of this is very instrumental in helping drive my passion
Hmm.
to help manage vascular disease today. Because out of these 400 amputations that occur on a daily basis, some of these can be avoided. Some of this can be mitigated. There can be lesser forms of amputations and not major amputations if we deal with the circulation problems ahead of time and if we even know that they're present and evaluate them. So that's why I'm really here today to talk about that and really make a push for it.
So, peripheral vascular disease leads to amputations if untreated, like you shared with us in your story. Why is a disease with such severe consequences, why does it remain so silent and, in general, unknown to the general public?
That's a great question. The problem is that vascular disease, it's the precursors are diabetes, it's hypertension, it's high cholesterol, it's nicotine use, past or current nicotine use. And these are often things that take a lot of time to develop. So we have an aging American patient population, and people over the age of 60 might think, hey, I've got leg pain with walking, but I'm over 60, and maybe that's just a normal part of aging. So a lot of things go unrecognized because it's misunderstood. And so that's why I'm here to bring awareness to the fact that if you're over 60, you're having leg pain and you're a former smoker, you might have diabetes, high blood pressure, you should feel empowered to ask your primary care physician for a circulation check.
Hmm.
That's really important. Because if the patient doesn't know that this isn't, quote unquote, normal aging, or if the wound that they have on their foot is taking a long time to heal and this isn't normal, then they're not going to make the inquiry. And oftentimes, my colleagues who are the gatekeepers, they're the primary care doctors, the family medicine doctors, the podiatrists, or the endocrinologists. They might have a suspicion for vascular disease, but they might not be sure.
Hmm.
And so then sometimes they tough it out and go it alone and try to manage it. But we're here to help. it's really important to emphasize that teamwork and collaboration is something that vascular surgeons, we're all here to do, and we want to work together so we can improve our patient outcomes.
In your article, you wrote that 80% of primary care clinicians lack the confidence in diagnosing vascular disease. I'm a primary care physician, so if someone comes into my exam room, like you said, leg pain, tell me the types of questions I should be asking that patient to determine whether this is vascular in origin or not.
Yeah, great questions. I typically ask my patients, what kind of pain are you having? Where is the pain located? Is it your calf, your thigh, your butt? When did this start? How long has this been going on for? Has it gotten worse over time? If you're walking up an incline, is it worse? Questions like that. And then I also ask things like if you've had wounds on your legs or feet that have taken a long time to heal. And one key question is if you're laying in bed with your feet up, do you have pain in your foot? And
Mhm.
then if the patient says, yeah, I do have pain, then I ask what makes it better. And if they say they dangle their foot off the side of the bed or they get up and walk around, that means they need gravity to bring blood flow to their foot.
Mhm.
And that really is a huge indication that, oh, there's a big problem here. So there's some typical questions.
So, how about answers to those questions? For instance, on exertion, what are some of the answers to those questions that would potentially signify a vascular etiology?
Yeah, if a patient says, I used to be able to walk a mile with my partner as we were just kind of walking up and down the road on our excursions together and talking, and now I can't walk that far. My partner can continue to walk, and now I need to stop multiple times. I'm having pain that's making my leg feel tired or crampy. Answers like that indicate that there's a problem with the blood flow. Oftentimes it would be unilateral, so one leg is the problem, and sometimes it might be both legs, but one leg is usually going to hurt the patient worse than the other. So them saying things like, I can't go as far as I used to. I can't walk my dog as far as I used to. I can't go to the mailbox without having to stop a couple of times because of the pain in my leg. Those are all great indications that there's a vascular flow problem.
So tell me in terms of next steps. So if I suspect a vascular problem, typically I order non-invasive tests like ankle-brachial index and pulse volume recording. So should I just refer suspicions to a vascular surgeon? Tell us what the role of these non-invasive tests before we send these patients to a vascular surgeon. So just tell me your preferred diagnostic workup.
Yeah, so those are all perfect. ABIs are wonderful and easy because sometimes we don't have, my primary care colleagues might not have PVR machines in their office. So you can do a quick ABI and get an assessment. Zero point 0.9 and above is generally normal. However, if you have calcifications of your blood flow, that number can be falsely elevated. So oftentimes what I'll just say is just refer them to a vascular surgeon
Mhm.
because we have accredited labs here in which we can easily perform these tests, and we have no problem bringing the patient in, assessing for their disease issues, doing the PVRs, doing the ABIs, and then making an assessment and then working together with you. So if it's just easier, if we don't have necessarily all of the tools available in my colleague's office, just send them here to us. We'll do it and we'll go from there.
So if we send patients to you and they are diagnosed with some type of peripheral vascular disease, just tell us what happens next. What are the options that normally is available to the patient?
So, first of all, we always want to manage our medical comorbidities and optimize them. So, if someone has an out of control hemoglobin A1C, they need to see an endocrinologist and get that really taken care of. If their blood pressure is out of control, also taken care of. I typically place all of my patients on a baby aspirin because that's extremely important and a statin medication to help to stabilize plaque so that plaque rupture can also lead to more catastrophic events. So the first front is certainly medication and medical optimization of their comorbidities. The second step would be placing patients on a walking program if that's something that's appropriate for them. And then thirdly, some patients absolutely need to have an intervention sooner rather than later. So those patients might be scheduled to get an angiogram, and an angiogram can be both diagnostic and therapeutic. So I can assess the blood flow, and if it's something that I can fix at the time, I can place a stent or a balloon to open up the blood flow. I will absolutely do that at the time. However, if that's not possible because there's multi-level disease, I'll then bring the patient back and have a conversation about a surgical intervention like a leg bypass.
So the decision point between surgical and medical treatment, what are some of the key factors that would sway you one versus the other?
Certainly, if a patient presents with what we call critical limb threatening ischemia. So that's someone who is reporting what we call rest pain. And that goes back to what I described to earlier. If they're laying in bed, they're having pain in their foot and they have to dangle that foot off the side of the bed or get up and walk, that's rest pain. Or someone who has gangrene or an open wounds, that places them in a higher category. And that category means immediately we've got to move because you're at risk of toe loss, limb loss, minor, major amputation. So those are the patients that we move on immediately. They get an angiogram, they get a leg bypass, whatever it might be, whatever the appropriate surgical intervention is. Now, if patients just present with claudication, which is pain in their legs with ambulation, some of those patients can be managed with just medical optimization. Some of them have disabling claudications, which really affecting their lives and they cannot go about their daily routine. I remember a patient who was a male person, a mailman, and he could not walk. He could
Mhm.
not work. He could not perform his job. So he had disabling claudication. So that patient I took for an angiogram and then intervened on as well. So patients who are critical limb threatening ischemia, immediate action. Patients who have disabling claudication, more immediate action as well.
A lot of patients fear whenever I send patients to a vascular surgeon like yourself, it means some type of major vascular surgery, like some type of bypass surgery, right? But talk more about some of the more minimally interventional options as well. You mentioned things like a stent.
Yes, yes. I like to tell my patients that the same things that you can do in the heart blood vessels, you can do in the leg blood vessels, just bigger. So some patients have just narrowing of their blood vessels, and you can go in and there's lots of different techniques where you can use drug-coated balloons to open up that blood flow, or just even a regular balloon. You can use particular devices to kind of shave down some of that plaque to minimize it, to also increase the blood flow. And then you can, of course, place stents. And there's lots of different minimally invasive techniques out there now, like shockwave and things to help break up some of that plaque that's present so you can have longer lasting effects of improvement of the blood flow.
Let's talk about screening. So obviously we screen for patients, make sure they're not smoking, make check things like cholesterol. Specifically for peripheral vascular disease, where are we in terms of potential screening options?
So screening options, it really is those medical comorbidities that you mentioned.
Yeah.
Those are all precursors to vascular disease. It's the diabetes. So we've got to screen patients for prediabetes and diabetic issues ahead of time. And that's where our gatekeepers come in.
Yeah.
That's where physicians like yourself come in. And you guys are catching it ahead of time before we necessarily get to vascular disease. So screening for diabetes, managing hemoglobin A1Cs, looking at patients' hypertension and making
Hmm.
sure that is really well controlled. Patients who have hyperlipidemia, making sure they're on statin medications. Smokers, it's really important to have conversations about smoking cessation and mitigation. That's extremely important. So all of those four entities that I mentioned, though, that's where the screening comes in, and that's what leads to peripheral vascular disease.
So in your article, you also talk about high profile figures like Deion Sanders, coach of the University of Colorado football team, and of course, former NFL player, bringing more attention to vascular disease. So what more needs to be done to bring this more into the forefront?
I think that this is a wonderful opportunity, and I really want to thank you for giving me the opportunity to speak here. Social media, having this platform, this is just fantastic because the reality is that 8 out of 10 Americans don't even know what a vascular surgeon does. Upwards of a third of Americans don't know the disease processes that are actually treated by vascular surgeons. So they don't know about carotid disease. They don't know about aneurysmal or peripheral arterial disease. So having platforms like this, where someone like me can come on and just speak about it and help to empower patients because you are your own best advocate. So if you have a concern, you can say, hey, to your gatekeeper, your family medicine physician, your internal medicine physician, say, hey, can I get my circulation checked? Because I'm concerned about this.
Mhm.
But that comes with first having the knowledge that this is something to be concerned about.
We're talking to Xzabia Caliste. She is a vascular surgeon. Today's Kevin MD article is The Silent Disease Causing 400 Amputations Daily. Xavier, let's end with some take-home messages they want to leave with the Kevin MD audience.
Thank you. I do have three take home messages. The first is to the patients. We're all patients in some capacity. We've all had family members that are patients, and it's really important for all patients to feel empowered. You are an advocate for yourself, so you can request a circulation check this month by your physician. And then you can have a conversation and say, hey, is a vascular surgeon the appropriate person for me to see as a next step? So, first, it's really about empowerment of patients. And secondly, I want to empower my colleagues who are the gatekeepers. You guys have such a gargantuan job managing all of the medical comorbidities of this aging American population. And I just want to say that we as vascular surgeons and I myself, we're here to collaborate with you and help you with the heavy load of managing this disease process. And we're here for you to refer your patients to us, and we'll work together as a team to manage this. And thirdly, just follow me on social media, LinkedIn, X, because I do post regularly about vascular related issues and vascular disease. And I also want to direct patients to yourvascularhealth.org. And you can get a much deeper dive on vascular issues. And this is for both my colleagues and other specialties as well as for patients.
Xzabia, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you, Kevin. I appreciate it.